Welcome everyone, and thank you for your time. We are Hawaii Healthy Building Experts Action Group, and we will be discussing workplace wellness and steps that we can take to make our offices safer for business. Today we will discuss what happens after we followed all the mandates of sheltering in place due to COVID-19 and all these restrictions are lifted. We have endured the largest work from home pilot project. Now we're returning to work. So what does that look like? What is a safe transition back into the workforce? The concern for wellness in the workplace is important now, but it's not going away in the future. It will be at the top of everyone's mind. We're all in this together, and if we transition carefully and methodically back to the workplace, create a safer culture with our team members, we can get Hawaii's economy up to speed, all while avoiding spikes to the COVID-19 pandemic. My name is Jennifer Camp. I'll be your moderator, and I'd like to introduce our panelists. First, we'll hear from Dr. Manfred Zapka, PE. He's an environmental systems engineer. He's a healthy building expert, lead AP, a well AP, and a certified energy manager. He's a co-founder and COO of Great Places and Spaces, LLC, and he specializes in healthy and productive workplaces, sustainable buildings, and infrastructure. Next, we'll hear from Philip Camp, AIA, lead AP, well AP, and certified energy manager. He is the principal of Hi.arch.y, LLC, and his specialty is in the design of mixed-use multifamily commercial office and is committed to sustainable design and occupants' health and wellness in the built environment. Then we'll hear from Dr. Phyllis Horner. She's an HR executive and a workforce consultant. She is co-founder and CEO of Great Places and Spaces and a business psychologist who advises leaders and professionals about actions needed to succeed in the workplace. Now, Phil and Manfred are the first well AP principals in Hawaii, where lead and certified energy management is committed to sustainability in the built environment. Well certification addresses the well-being of the occupants in the built environment. They made the commitment to well long before most of us knew what well certification was. Now, this shows their early commitment to the occupants' health and well-being in the built environment. And Dr. Horner, she has brought equanimity to our group. In times of very real and sobering discussions, Phyllis has brought positive perspective and helped us navigate through thoughtful discussion. HHBE, Hawaii Healthy Building Experts Action Group, teamed up long before C-19 pandemic and has focused on the benefits of health and wellness within the built environment. With the onset of C-19, our group pivoted, and we provide credible, timely, sound advice. Now, what makes HHBE unique is that we look at the workplace environment from all angles. Now, let's think about it as a holistic approach. It's in the design space, the psychology and culture of the workplace. Right now, more than ever, it's important that we have a safer place to work. And it's also important that our workplace is conceived to be safe. Additionally, our connectivity to up-to-date information, and it's not just web research. It allows our team to provide solid advice as we navigate the inundation of COVID-19 information. Throughout this whole endeavor, there are heroes everywhere, and we want to thank them. We have our first responders and everyone who's been sacrificing to help our Hawaii community. Not only our doctors and nurses who are keeping Hawaii community healthy, but our financial institutions who have stepped up and helped us with our PPP loans, and our construction industry who has continued to build homes and keep our community employed. Even those of you who are working from home, you've all done your part, and thank you. So our outline is shown here. Manfred will be talking about healthy and safe spaces to sustain a productive workforce and retain talent. Then Phil will follow with workplace wellness practices in response to COVID-19 with a focus on efforts that can be done right now. Then Phyllis will follow up with ROI of human-centered design in return to work. Now let's get started.
Well, thank you so much for having us. And Jen said we've been working for about a year right now, and our goal is to promote healthy and productive workplaces for every occupant and visitor and customer. And my name is Manfred Zapka. I've been working on applied science in the built environment for a long time, and with Phyllis Horner, we have formed Great Places and Spaces after working side by side in separate businesses for 15 years. So what we would like to talk to you actually today is the what, why, and how. What do you need to ensure safety and engagement and productivity for your own team, and to provide some resources for you to try and share with your lessees who are planning for employees' return and opening. And although we're talking a lot about facts today, we don't know everything about this evolving crisis. I mean, nobody does. Things are complex and change by the hour, but we would like to give you some great advice today and share some of what we have learned. So today, very quickly, we'll be speaking about how to protect employees and clients, how to protect your tenants, and what actually can we afford in prevention? What is the best ROI? Not necessarily only the money, but how do we actually distribute the efforts? And also, like, what kind of liability could we actually have if we open up? Next, please. So this just very, very quickly what we are doing in great places in space and what we believe in. So we think a healthy workplace are essential for a modern workplace. And, but we specifically think that combining corporate culture, and physical spaces yield the best results. And this is true for normal time, which actually is right now our productivity roadmap comes from. It's an intuitive description of, that the physical workplace and the workplace culture both interact in order to give you the best results. So what are the benefits? Usually, even again, like in normal time, COVID is much different right now. It's lower health related risk and cost, higher productivity, high engagement, and attractive ROI. Thank you. And next one, please. So what we said, right, very, very briefly, healthy buildings have become a competitive advantage for, multiple buildings. Could be residential, but specifically commercial buildings. So we have two things, the physical side and the people side. And you see all this box has a lot of components. So it's not only one thing fits all. It's very specific to the client, to the situation. And so that actually means the best thing we have is interacting. It's interlinking these two aspects, the physical and people side. And what is important for normal times is much more important right now, because it supports, right now through our crisis, it supports our defenses against COVID. Increase actually the resilience and builds trust. And by actually lowering the stress level, both from the physical and the people side, and then actually the immune system is also strengthened. And of course, the biggest thing right now for most of people on the mind is it keeps our economy going and keeps us all engaged. Next one, please. So right now, this one should not intimidate you. This is not a sprint, what we're in. It's a marathon. And on the right side, the hammer and the dance. It's been something like which goes through the media, which is really a nice intuitive description. First, we had the hammer, and everybody had to endure that for a while. It's a lockdown and so on. So right now, we are coming out of it. And right now, what's happening, or the best picture is, we are starting to dance with the tiger. And that is like, we have to be agile, we have to be flexible, we have to respond to what's going on. So it's really, we have to dance with the crisis. We cannot be only just, fixed with one thing. Actually, we might also have to change, which we see when new evidence coming out. On the left side, which seemingly this complicated diagram is actually something which is of a good hope, it's hopeful, because it basically says, like, what are the economic that you have balancing the public health, you can balance it with economic concerns. And the diagram says, like, this blue line is like the impact of the economy. And the line to the right, the horizontal axis, has the virus reproduction value, RT. Everybody will hear that about in the next year, so it's good that you understand it right now. And what it says, actually, whatever is the RT value, that's the effective reproduction value. Whenever that is above 1, then actually the epidemic is just going, it's increasing, like, the problems are bigger. If it's below 1, then actually it's going, it's receding, we are getting better. And there's some kind of what we can do, and you see it's about 0.75. They say if we keep it at this point with whatever we're doing with all our mitigation measures, then we can keep it there and we can have the economy going. So it's a good sign. Next one, please. So that's also not only like on the mega level, on the micro level, where we directly can make a difference. It's like that we can say the healthy buildings is actually our secret weapon, from the architect, from the engineer, from the building's psychology. So, and that actually means that we have to have strategies, but we also have to implement well. And see, this is like the space. It's not like in the horizontal, if we have good intentions, but we never implement it, it doesn't help us. So the mantra has to be conserving cost and effort, keep productivity, and staying competitive by actually doing good strategy and knowing how to implement it. Next one, please. So right now, actually, we have been hearing this, because we have been out in the field speaking about healthy and productive workplaces, and usually the response is, oh, that's a great idea, and if we have some more money or so, then come back next year. So that's no more anymore. Right? No, this is not, because the COVID universe we are in right now, it's like if we do not act, our businesses will not survive. So it's become a business imperative. So it's worthwhile to really listen up and to put it actually into action for your own business. Thank you. Next one, please. So right now, let me just do a little bit of speaking about the COVID thing. What it actually is it's a bad bug, and it's very contagious, and it can cause a lot of damage. And there's what actually is the good thing is specifically in March or February, March, we could rely on existing data from SARS. SARS is also another coronavirus which had a lot of damage in Asia, a couple of years back. So at the beginning, we could actually use this information and move forward, give some good advice. But right now, much more is coming up basically by the hour. And it's just, it's amazing how things, what can actually happen if everybody pulls on one string, so on one rope. And it's really great. There's still uncertainties. And for instance, the uncertainties means, what is the minimum infectious dose? Means like, if you inhale like a couple of viruses, it might not really do a lot of damage. But it has to be a certain, number or threshold that you can really get an infection. So we have two kinds of transmission, and right now we're not speaking about public health in general. We're speaking how can we reduce transmission in the built environment. One is the contact transmission. That means actually we have to clean things, and what we do anyway, just cleaning functions or whatever, what kind of detergents we take. And the second one is airborne transmission, but it's also including the droplets everybody probably has heard. And we look at it, the importance is really like, this is the 800-pound gorilla. That's where it's sitting. That's actually where we have our biggest leverage. Next one, please. So let's look a little bit about, what's happening. And you see on the left side, the host. The host is infected, and the host actually can shed virus, and it's called viral shedding, sorry. And it's different. Not everybody sheds the same amount. So it depends on the person, whatever, but some people shed more, some people less. But everybody sheds droplets and also aerosol. But droplets is the biggest concern, and that's actually why the 6-foot rule came about. We made a hypothesis that it's about 1.5 meters, which like we rounded up a little bit, and we're 6 feet. So that's actually, if we stay that kind of a distance, we are not affected by these droplets, because the droplets will, it will impinge on us, and if it gets on our respiratory tract, or if we inhale it, then actually problems can be caused. So the first, line of defense, and Phil will speak about that, is the mask, because if we wear a mask, we can actually filter out, and even some of the aerosols, apparently right now it's filter out. But you see this one right now, the aerosol in yellow on the right side, it's in addition to the droplets, either it's exhaled directly or the aerosol forms from the droplets. It goes much further than the 6-foot rule. And it can actually remain suspended in the air for a long time. So a long time is like an hour, 3 hours or whatever. And on the left side is, what actually is when, a lot of droplets and a lot of stuff is generated. And this is like, the sneezing is the worst. If you have somebody sneezing, has to have a mask, or, you put something in front of your mouth or whatever, then coughing, healthy breathing, singing, normal, and just breathing. Even if you breathe, you expel. But what was kind of interesting was like, there was a recent study from South Korea, and they said like they had, like a gym. And the gym, the Zumba was the worst, because apparently, there was a lot of droplets coming out, whereas Pilates was better. So, I mean, you just you have an idea, that it's really practical, and it's really good to visualize. It's also good for you, because we hear all this big, big guidance or so. How do you actually can protect yourself? How can you actually be effective and use that knowledge to protect you? All right, just to give you an idea, like how many droplets actually they're going out of the mouth if you have an engaged speaking. Like me, I'm just speaking right now. I'm just not speaking like slowly. So I can have about 1,000 variants per minute. And they hang in the air for about 8 minutes. So, in the breathing air, about 8,000 will just stay there. Next one, please. So that's basically right now, just, want to wrap up. And, what is the risk of exposure? Because that's actually what we are talking about. In the built environment, our goal right now is to lower transmission. We cannot do anything else, but that's our biggest leverage here. And it goes from the right to the left. From the right is something outside, and it goes to the circle to the left, which is like a cramped workplace, bad ventilation, all kinds of stuff, and bad air conditioning, means like not good temperature or humidity. These all can affect it. So, and something else is in the middle, but just keep that in mind. If you just keep this part from my presentation, is that the outside risk is much smaller. There was a recent study from Japan, and where they actually, could trace what kind of transmission was caused by where people were, and it's about 20 times higher the risk inside than outside. So that's staggering. So, but that actually, you can also see, you have still to keep distance from the, the droplets, big droplets, but the aerosol is much less a problem outside than inside. So that means actually, if the wind, goes between us, we know the wind actually, we always say, is our friend. The wind keeps us, healthy, and so that actually will help us. So that actually was all I wanted to tell you in my little 30 minutes time. Thank you so much. And so I'll introduce the next speaker. It's Phil, a good friend and a very good professional. So Phil, take it away.
Thank you, Manfred. Certainly appreciate that introduction, and definitely love hearing about the science behind all of this. I think it's helpful for all of us. So as Manfred mentioned, my name is Phil Camp. I'm principal of Hi.arch.y LLP. We're a local firm with offices in Honolulu and Los Angeles, and we focus on large mixed-use multifamily projects and commercial office projects. But in all of our projects, we have a bent towards sustainability. And as Manfred mentioned, both Manfred and I were two of the first WELL-certified professionals in the state of Hawaii. And for those of you who aren't familiar with the WELL certification process, it's a certification process entirely premised on the health and well-being of the occupants, more so than actual bricks and sticks of the project. So that's really what brought us together, and we've been focusing on health and wellness since then. Next slide, please. I think one of the primary focuses of our efforts as a joint team with Great Places and Spaces and Hi.arch.y has been the 330-300 rule. The 330-300 rule is fairly well known in the health and wellness design industry, and it's the basic premise that any business or operation on an average scale is looking at spending $3 a square foot on utilities, about $30 a square foot on rent, and $300 a square foot on their people. So clearly, the most important and valuable part of any business are the people within. So, when we're looking at it, we're certainly big supporters of increasing energy efficiency, and we love lower rents. But by far and away, if there's a dial that you can turn to increase the efficiency of your practice, of your firm, of your office, it's how can you increase the productivity of your people. So with the 330-300 rule as the underlying premise of all of our efforts, we're always looking at ways that we can increase, you know, people's performance, have them have fewer sick days, more attentive when they're at work. And by doing that with health and wellness focused design, the returns can be very significant. So we took that focus, and with this recent pandemic, we thought, well, shoot, there's nobody that knows this stuff more than our team. So let's see if we can help by sharing some of that info with the C19 bent. Next slide, please. So if you jump on our Hi.arch.y website, you can get all of this information. This information will be free for people to download as well. But we share this office guideline as people start rolling back to work. And this office guideline is on our website. It's interactive when you jump on the website. And each one of these critical points has a toggle that you can click on and gives you all kinds of good information about each of these critical points, whether it be signage, hygiene, spacing, or just cleaning. So I'm not going to go through each one here, but I want to share this as some of the efforts we're going to be talking about. So I'll dive into some of the more important ones as we get moving here. Next slide, please. So usually where we start in the built environment, certainly within an office environment, is the messaging, and signage is usually that that critical part of that messaging. So the two signs here we have shown on the left are signs that we actually have in our own office as we've started rolling back into the office. And signage provides critical messaging because it represents your brand. So, you know, you want to be clear, concise, straightforward. You want to let people know what your protocol is, but you want to send the right message. You want them to understand what you're about, what you're trying to do. So the sign on the left is on our front door. Pretty simple request there. Ask people to wash their hands before they come in. For the most part, most of our meetings will still be on Zoom. But if we do have in-person meetings with our clients and partners, we're probably looking at products and samples and handing them off. So for us, that's the critical first step. Certainly looking to ask people to have masks on. You know, you protect me, I protect you. Simple but logical. Looking to maintain distancing, and then again, just ending it up with a positive message. Mahalo, thank you. We want people to come into the office. We want their business, and we want this economy to fire up, and as soon as possible, as soon as we can safely do it. So the messaging helps with that. And the one on the right kind of dates me a bit. For those of you who've been around locally in Hawaii, this is a state campaign back in the 70s and 80s for cleaning up our public spaces. So we modified it. Hopefully there's no infringement rights there, but the message being, you know, wash your hands to save our land. So the idea is that, you know, wash your hands. Good hygiene is certainly one of the best items we have to defend this virus. So start with some right messaging and be cognizant that the messaging will affect the psyche of not only your employees, but your clients and your visitors as well. So you want to be positive, but clear. And then I think one of the important parts for signage and any messaging really is communication. So signs are part of that communication, but emailing ahead of time, letting people know what to expect. What is your protocol before they come back to work? So they don't show up with an awkward arrival and maybe they don't have a mask or they're not expecting to follow certain protocol. Give them a heads up. Let them know you're trying to help them. You're trying to make that space in your office as clean and safe as possible so that they can come in and get down to doing some good, positive work and be productive. So they're not thinking about, you know, is this place safe or not? Next slide, please. The next part, we talk about mass and air quality, and that's a critical component of any healthy building. Always has been, always will be. Indoor air quality is a huge component about personal productivity. The healthier, cleaner, and fresher that air is, the more attentive your employees will be. You know, it certainly helps reduce sick days. But obviously in the C19 era, it's even more important. So as Manfred mentioned, that's the 800-pound gorilla. Airborne infection is a potential. Certainly it is known now at this point that airborne particulates do exist, whether they're microdroplets or aerosol. What we don't know, and this is being studied, and we're talking to people at the National Institute of Health, and Manfred's talking to people in Germany, is the infectious dose. So we don't know what the infectious dose is, but there's good logical things we can do. So the first, of course, is wearing a mask. If we can prevent the asymptomatic shedders from shedding, because no one's hanging a sign around their neck saying, I'm sick, or I think I'm sick, you don't know, and you can still shed. So the idea is wear the mask to prevent potential shedding from the first place, right? So you don't get it into that built environment, because in the built environment, you got to think about volumes of space, and we're moving, walking, operating in those volumes of space. So a mask will prevent the potential asymptomatic shedder from shedding virus in the first place. But it has to be part of the equation. Again, we don't know what the infectious dose is or how much of a component this is to the transmission, but we do know that there are airborne particulates, and we do know that it can hang in the air for a while. So if we can move it, flush it, clean it, obviously that's got to be better than not doing anything at all. So that's kind of our perspective. And again, these are all good steps, C19 or not. Getting clean, good air exchange has always been beneficial for the built environment. And we have good information on this. Again, you can get all this, but you can see there's links there. And there's a lot of good info on just the science behind this. Next slide, please. So the next one we talk about really is enhanced cleaning protocol. And again, very standard, very simple things. The enhanced cleaning protocol has been part of the WELL certification practice since it came out in 2014. So again, nothing new. But certainly beneficial for the health and wellness of your occupants within the built environment. So we have good information on our website, but the highlights here is, tackle the high touch areas. Every office is different. Our office is not a very public facing office, like say a bank branch or a grocer. So maybe we don't need as much cleaning as they would, but you got to look at your office and what the requirements are, but you want to hit the high touch areas. And then when it comes to cleaning, label is the law. So whether you're doing your cleaning or your cleaning crew is doing the cleaning, they should understand how to use those cleaners. Every cleaner is different. I mean, if you look at Clorox and some of those Clorox wipes, they have specific dwell times and kill rates. And if you're not leaving that product on the surface before wiping it off for the required amount of time, it's not doing its job. So understand the labels, and your staff should understand those labels as well. And then create a schedule, right? A schedule that you can stick to, one that's realistic. I mean, keep in mind, you're going to have people coming back from their homes. Some of them might have been cleaning every hour on the hour, and others maybe not so much. But it's going to affect their psyche if they come back to your workplace and no one's cleaning anything, or nothing's even been addressed. So have a schedule and get one that you can stick to, and empower your employees so they can clean their own space and be part of the solution. And again, good links there. American Cleaning Institute has a lot of good info. And then we also have the link for the EPA List N. So that's the approved list of cleaners specifically approved for coronavirus cleaning. Next slide, please. So Manfred mentioned this a little bit in the built environment. Again, the 800-pound gorilla is the potential for airborne spread. Again, we do not know what the infectious dose requirement is there, but certainly the virus can live and does remain in the air for a period of time. So our basic philosophy here is wind is our friend. Again, this is good logic for almost any instance. Fresh, clean air is a huge benefit to physical performance. So at the top of it, we can start with opening windows. People working at home can do that right now, or if you're in some of the older office buildings in town, you can open those windows and get some fresh air in there moving through and flushing. So at one end of the spectrum, if you're outside, as Manfred said, that's probably your ideal scenario, fresh air, continual flushing. At the other end of the spectrum, probably worst case scenario is in a small confined room with horrible ventilation and no circulation. So obviously we want to move away from the bad end and move towards the good end of the equation. So if you can open windows, get some positive air flush in there, that's certainly a benefit. Now you can't do that in every office building. You have a modern curtain wall glass office building, you're not going to be able to crack that window open. So in those instances, something as simple as a small desk fan will help with the dilution. Now dilution is helpful. It's not as good as flushing and getting fresh air exchanges, but if you can dilute the potential for micro droplet buildup and getting that airborne density higher and drop that airborne density, that's got to be a benefit. And that's what we're hearing from the white papers that we're looking at. Purifiers will help, and there's a lot of other options that you can follow. And then if you have the capacity, in the newer buildings, a lot of them do, if the existing HVAC has that existing bandwidth, you can ramp up the air exchanges, you could increase the filtration, all of that probably you need to start talking to your systems engineer. But there's a lot of simple steps we can do right now ourselves, and then the system solutions we can start looking into probably in the next phases of improving our health and wellness in our workplaces. Next slide, please. I think where I want to end is really on the simple logic that every workplace is different. We can tackle simple efforts right now. Almost all of them are things that we can do ourselves. So it's great if you can tackle some of those system efforts and increase your HVAC filtration or ramp up the air exchanges. But the simple things and probably the most effective things are the things we can all do. So if we look at every office, they're different. Job site trailers, I'm still going out to job sites, always have been, haven't stopped. We have essential building projects going on all over the state. And we need to get out there and we need to help those move on, but we can do it safely. So if you're in a trailer, those have been notoriously poorly vented, always smelly job site trailers. Nobody likes going in those anyway, but if you can open the windows, crack a door, get some fans in there, get some air flushing in there, that'll help tremendously, certainly in knocking down the potential for airborne droplets to build up in the built environment. Job site build out areas, the guys are working hard. If they're asymptomatic, they could be shedding even with masks on. And if they're working really hard and in a small space for 8 hours, especially if there's no HVAC in there, right? So hook up your air movers to your generator and get those spaces flushing with fresh air. That's going to help. And then the forward-facing kind of offices, point of service tellers, grocers, bankers, those guys haven't left either, and they've been working the front lines. The acrylic screens help quite a bit. That'll certainly help with some of the heavier droplets, which is seen as a critical part of transmission. But again, if we can just dilute the potential for airborne buildup, if people are standing in line waiting, if you can have a small desktop fan that can dilute that density, that'll be is certainly recognized currently as a benefit. And these are all things that we can do right now. So hopefully all of these things are helpful and beneficial for you guys. And with that, I'm gonna pass it on to Dr. Phyllis Horner, and she's gonna help you understand the benefits of a human-centered design return to work. Thank you, guys.
Well, thank you, Phil, and thanks, Jen, for the true introduction about why is this all so important? Because we're really committed to our community and we're really trying to curate all the best information. As you said, we don't always know everything. Nobody does anymore. So we are updating our presentation and we're looking forward to talking with any of you that want to talk with us about what's going on with you, your business, from the physical or the psychological end. If you want to know more about the science, we're definitely up on that, and we'll be having things on both of our websites regarding that. So thanks, Phil, for your ending, which basically kind of said simple efforts can make a big difference. And I think definitely that's kind of where I want to start out. I'm Phyllis Horner, and I've been working here in Hawaii for over 30 years. I've been an executive within companies as well as a consultant on the optimization of the workforce. I've written and co-written books on the future of work and where we're kind of headed now and on productivity. And basically the bottom line today with you guys is why we should consider human-centered design and the return to work, and what is the ROI of that for your business. My basic premise picks up off of the 330-300 with 2 points. One is that 330-300 was before the social distancing and the de-densification of the workspace. We are going to have to redo those numbers, and it's going to be more costly on the people end once we do that. So the idea there is every single small thing, every single small effort you make with your people is going to pay even a bigger dividend than it did before. We should basically see it as not a cost, but a necessary cost of doing business. Second thing that I really want to say is that a healthy building only gets us 50% of the way to the goal line. It doesn't get us the whole way. As you're going to see as you reopen your spaces, people will come back, and then the old norms will have to be broken. Some of this has happened at home as people have been working at home. Many of us have gotten used to this two-dimensional world of Zoom. But I think the thing that's really going to happen is because you have a pent-up need for people to be together, they're going to want to connect. They're going to want to walk by each other's cubicles. They're going to want, and they maybe not even to go on the one-way path. They're going to cross, and they may do things that you don't anticipate. So helping them to have choice and to buy into the utility of the beautiful space that you designed is one really important aspect that we're seeing become more and more important. And just an aside on that, we've come to this recently because of all the things that are happening with the protests, as well as the crowding on beaches. And we see people who have known what they should do, not doing it. It's a human thing. And I just want to say, it's not a judgment. We honor it, we feel it ourselves. But you as business owners and leaders are going to need to help people to continue to do the right thing based on all the work you did to get the building ready for them to come back to. It's easier with customers. So next slide. So I'm just going to talk about the ROI of this a bit, and that is the human-centered design means that we redesign the environment to maximize the productivity and well-being of the user, and that's what you guys have just done. The ROI of human-centered design means that you can measure how much you save or make based on those changes that you make to the space, and how you tie it to your strategy as well as to your employee engagement efforts is kind of the focus of the rest of this. A couple of the examples here are for disengaged employees. This is one that everyone probably knows if you've done any employee engagement work at all. Gallup estimates that if you don't have a fully engaged employee, it costs you 30% of their annual salary, including benefits. Think about that, and then think about the percentage of people that you know that were disengaged before the pandemic. What do you think has happened to those people while they've been working at home? Do you think that they magically became more engaged? Or do you think that when they come back to the office, you're going to have an unknown on your hands? We're trying to help you to mitigate that cost to your business, and you'll see how later. Another is healthcare premiums. In the businesses I've worked with over the last few years, increasing rates for healthcare, even when there was a cost sharing with the employee, has been going up steadily. What do you think will happen to that post-pandemic if you aren't careful about helping people stay healthy, even if you have to create new norms for that? Then stress. 100% or maybe more, if there is a way to do that, of the people we know are overwhelmed and in stress. Many people say their stress has gone up. The American Psychological Association has studies on this that show that this is the highest stress level financially, personally, professionally, health-wise, worry, future-oriented, that they've seen in over 12 years since the last recession. And this one is much worse in the sense that the health factor was not included before. So if you look at this stat, you see that 40% of employees pre-pandemic, again, 2018, said that their jobs were already very stressful. And for those employees, healthcare costs are 44% higher than for others. Something to watch. So these are just examples for you, and we'll have these slides available for you if you're interested, just so that you can say, okay, I've got something to think about here. Finally, the psychological reaction to the physical stressors is where I'm headed next, where that has been shown out of the Harvard Healthy Building group to cost a business $4,000 to $6,000 per person affected by noise, light, cramping, air quality, and ventilation problems. That was pre-pandemic. And now you can imagine that those numbers will change, but not going down. If you do it right, you're saving that potential cost. That's our message. So if you go to the next slide, you'll see, let's move away from the money and into the people. If you had 100% of your employees fully engaged prior to the pandemic, you would still need to make change coming out to increase what you do to show caring and trust once you've created all the time and money you've put into your building coming back. And the reasons are that people have changed fundamentally while they're away. They may definitely miss coming in and being with you, but what they don't, and none of us can measure yet, but we're sure it's there, is the freedom that they're losing by coming back, how they're going to feel about that. If they had a micromanaging manager before they left, that manager couldn't actually stand over their shoulder. They might do it electronically, but now they have to come back to that same manager. How is that going to affect them? And so if you kind of look at it, my only point on this slide is you've got to think not only more safety, but more choice and more management practices and policies that update to the modern workforce that we're going to have when we come back. Next slide. So the bottom line of it is really to plan to bring back the whole person. When I came up in the humanistic psychology era, and we were always joked with by leading managers like Fortune 5 companies I was working with. Oh, well, you know, we're hiring the body and we're hiring the mind, but the body and the spirit, oh, they just come along with it. Can we do anything to minimize that impact? And of course, we've come a long way since then. But the truth is that we need to rethink, even if we have been worried about the body and spirit of the person. We have to rethink that, the body from the safety aspect and the spirit from making sure people can focus on their work without distraction, as Manfred said earlier, and get the best results for your business. So this is not something you're doing to benefit the person and not your company. This is something you're doing to benefit your company and the person, the traditional win-win. So if you kind of like go to the next slide, we'll dump into that a little bit, we'll dive into that a little bit. Our methodology and our approach, and I think it's different than many, many others that we're tracking across the country right now, is that rather than ask people individually, you should ask them privately, confidentially through a survey mechanism. What is essential for their best work? Now, let me explain that just for a second. The idea of a manager asking a person, what do you want when you come back to the workspace? Here's the cubicle we have assigned for you, and it's 6 feet apart from the other one. Is that fine? Okay, so the person is 99% likely to say, yes, that's fine. But underneath of that, what is that person really wondering and thinking? If you trusted your manager, and I guess trust is the key word for this slide, you might say, I trust my manager to create a safe space for me, and therefore whatever they want to do, I'll go along with it. But even then, the person might say, why didn't they ask me first? Why did they ask me this way so that I'm going to be found out and other people will know what I said and they'll talk about me and maybe I won't get that raise next year. And if you think about your own reality, you know that's true. I mean, I know from working in businesses myself here in Hawaii that even when you say yes or no in a meeting or if you speak up, you're taking a calculated risk of how people will perceive you afterward or whether they'll think that you want to be better than them or you're competing with them. And you know it's true. So the safer way to go about it is to ask people these 4 things about these 4 things confidentially. And we've created a free, confidential, easy to take survey online that we're calling My PQ Work at Home. Here are the 4 areas. What is your risk tolerance for coming back? What are your fears about coming back to work? How have you been doing working at home? What kind of work environment helps you have the most focus and results? And which one of these 3 workforces are you? Although we coined that term, we don't use it in the survey. Do you prefer to stay at home most of the time? Do you prefer to be in the office most of the time? Or do you prefer a hybrid arrangement? Now, if you as employers know what your people think about this, we can do a roll-up report for you that helps you see, oh, 100% of people are ready to come back. Well, great. End of story. But what kind of management practices do you need to make them happy that they're back? That's the second part, right? So we encourage you to take advantage of this free survey, which is free until June 30th, because we believe that we're committed to our community and we want things to really not only start up day one well, but to actually materialize the way you have in mind. Next slide. So again, on the left, you see the things that we mentioned on the prior slide. And the reason for the 2 columns is just to say, the purpose of knowledge is not information. The purpose of knowledge is action, right? And so what do you change as a result of what you learn? You may learn that you people are worried about wearing masks, and so you need to do some sort of breaks to get out of into the fresh air. You need to change the schedules perhaps so that people who have been working, I think the last report I saw said people feel like they're working 24/7, even because when they leave their camera at 6 to make dinner for the kids, after that, they're expected to go back and check it. You may need to change that schedule. You may need to rechange your spaces once people come back because of the fear of the concern of taking something back to their household after. You may need to change those spaces over time. Don't be bummed out by that, but you can predict it based on this survey. You may need to change communications and include that now, as Phil said. And some health rights are going to be affected. And so you should be looking, and we were on a call yesterday where the many HR policies that will need to be affected really talk about increased rights for a healthy workspace for employees and for your customers who come, so that you prevent any sort of cost in settling a claim that may come, that even if it's not a real claim, it's going to cost you money. So main bottom line here is one survey, one time is not enough. When people come back, you're really going to want to keep up with that and prepare to pivot. I think prepare to pivot is kind of the watchword this year. Okay, next slide. This is just a visual of what we already said. The only new thing here are two things. One, on the now, is the cross-functional leadership planning team. We believe you should connect your strategy, your marketing people, your communications people, your HR people, your risk management people, your facilities people, all together in one room to plan this. If you're too small and you are all of those people, then wear all of those hats at the same time. And then planning your initial schedules based on what that team does, as well as the reallocation of budget. What are you going to be putting your money into? That we know money's tight for everybody, so it's really what are you going to be putting your money into? And then the other one on the 1 to 3 months past is phasing the return. Many of our community are doing that. They're phasing the return. Some banks are 6 on, 7 off, or 7 on, 6 off already. Adaptable schedules based on things that change at home. And the rest of them we pretty much talked about, except for this one, teaching managers. Now, managers are going to have a hard time if they're thinking that the workforce that's coming back is the same workforce that left, and it isn't. So if you're interested in more information on that, you can reach our HHBE team or Great Places and Spaces. We'd be happy to custom tailor a Zoom training for you, or you can take one of the ones that we already have up on our website. So that's really my message today. And if you change the last slide, we're going to want to annually look at this just as we do everything else. The bottom line here is that you cannot forget about differentiating yourself with your workforce and your customers just because we're all in the same leaky boat. We're all trying to do the best we can, but once things do come back to normal, we'll be back to competing with one another pretty heavily. You're going to want to be the place that employees and customers want to be. So if you're looking for an easy checklist to use, we've created that on our website at greatplacesandspaces.com, as well as we'll put it into our end slide so that you can get to it easily afterward. Thanks a lot, and I'm going to hand it back to Jen and wish everyone well.
Thank you so much to all our panelists. I just want to give you a side note on the MyPQ survey. It was really helpful for us in assisting us as owners and understanding the needs of our team when we get back to our office. And our office did participate in the survey, and it helped us make some very important decisions as we return. Just wanted to close by saying that we're here and we're local and we're all in this together. So if you do need to speak to either one of us, please check our websites. Our contact information is on this last slide. We are Hi.arch.y and Great Places and Spaces, and we're really looking forward to the economy picking up and seeing you folks in downtown doing business. Thank you so much.